Can a brain tumor surgery be done without affecting movement or speech? The answer to that is yes. How is that possible? Well, there are two ways we go about it. The first one is that we do what we call a functional MRI. In this case, we do a specific protocol in which we ask the patient to carry out specific movements and also speak a few words. The MRIs then can pick up that specific area of the brain which is responsible for speech as well as the movements. Now, once that is done, I know the relationship of those critical areas with the tumor, and I will tailor my approach to the tumor so I can safeguard that areas. Now, this information from the MRI then goes online to my operating theatre, and we all have what we call as image guided systems, which, working like the GPS, can take me to the brain tumor with an accuracy of 1 to 2 millimeters. How we do that? The MRI is done before we actually operate on a model and on a screen. I plan the approach. This information, the planning that is done on a planning station, is available to me real time during the surgery, and that's how I protect these critical areas. Another way of doing this is that in case these areas are within the tumor area, we do what is called a awake surgery or a awake craniotomy. The anesthesia today is so good that the patient is awake, can speak to me during the surgical procedure, can play musical instruments, and not yet feel any pain.